Today we're going to have another very special show. We have Dr. Stanislav Grof with us, the author of this book, most lately, The Cosmic Game, and also of The Holotropic Mind, and actually a series of books over the past few decades of writing about transpersonal psychology, mind expansion, and is also the founder of the International Transpersonal Psychology Association. He has been a leader in the field of psychiatry and psychology, especially pushing the boundaries of our common understanding of normal states of consciousness and what are expanded states of consciousness. So it's really a joy to have Stan with us today, and we'll be speaking about the body of his work over the past many years, and then about this particular book and the holotropic breathwork in general. So Stan, thanks so much for being on the show.
Thank you very much for having me. Yeah.
Absolutely. It's my pleasure.
Pleasure to be here. Yeah.
Good. I'm glad. Yeah. If you could please share with our audience, because your life has taken such an interesting turn from being originally a medical student in Czechoslovakia back at a time when psychedelics and hallucinogens just were not well known, nor the ideas which are now concerning transpersonal psychology. How is it that you originally got involved in this whole world?
No, I was born and educated in Prague, in Czechoslovakia, and my original intention was to be a psychoanalyst. Actually, my previous intention, had been to be involved in animated movies.
Oh.
And I already, when I was finishing,
actually.
Yeah,
in a way.
Didn't go that far from the original intention.
Yes.
But anyway, I already had an interview. I was supposed to start in the film studios in Prague. And just at that time, a friend of mine gave me introductory lectures to psychoanalysis by Freud. And I started reading it in the evening. I couldn't sleep. I sort of read it through the night.
Yes.
And within 2 days, I decided this was it. I was so taken by Freud's logic, into how many kind of obscure areas he has penetrated and giving these seemingly brilliant explanations.
What years were these?
Well, I started the medical school in 1950, and I graduated 1956.
Were you reading in German or Czech?
Czech.
Okay.
Oh, you mean Freud?
Yes.
Yeah, I can read. German was my second.
Okay.
But
sure.
The medical studies were in Czech.
I ask only because there's so much from the original German with Freud that was lost in translation to English, as Bruno Bettelheim went into in his work, that you got the real juice.
No, Freud I read in German, but the basic study was of course in Czech. Mm-hmm. And so I got my medical training, I got my analytic training, I got involved in personal training analysis. And then I started developing a really deep conflict, which was between the kind of continuing excitement about the theory, but then an increasing disappointment about what you can do with psychoanalysis as a clinical tool.
I was so glad when I read that in your book, because that has also been a frustration of many people in the therapy field.
Sure.
So much of the theory is so excellent, and the clinical application is so lacking, you know. Unless hundreds of thousands of dollars later, you may get incrementally better, maybe. And that might be just a function of time.
Well, there was this, tremendously narrow spectrum. You have to meet very special criteria to be a good candidate. Yeah. And then even if you meet these criteria, then you have to commit yourself not to months, but to years, and enormous investment of time, money, energy. My analysis was 3 times a week. And then even after years, the results are not exactly breathtaking. I loved my analysis. I loved every minute of it. And if you ask, what did it do for you, I would say, well, I changed in those 7 years, but I certainly cannot link it in any way to the free associating. Probably have changed anyway.
Were there many of your colleagues that also felt the same way at that time?
Pretty much, pretty much. So I got to the point where I started regretting that I ever chose that discipline. I started kind of thinking back, about the animated movies.
Yes.
And that's something.
Back to film.
Yeah. And then something very, very dramatic happened in my life. we were doing some work for Sandoz. We were testing Malarial, which was one of the early tranquilizers, and we had a good working relationship. And so they sent us one day a box full of ampules of LSD. And they asked us would we work with it and give them feedback whether there was any legitimate use for the substance in psychiatry and psychology. And one of the things they were suggesting, maybe this could be used as a training tool. You know, the early research has shown that somehow the experiences seem to have something in common with the psychotic experiences. And so there was an opportunity for psychiatrists, for psychologists, to spend a few hours in the world of their patients.
I see.
And so
It's
I got
an
very,
empathy
yeah,
tool.
yeah. So I got very excited. I wouldn't have missed it for anything in the world. And I volunteered, you know, for that experiment. And that was the beginning of a whole other adventure. I had such profound confrontation with my psyche, with my unconscious, that it just instantly overshadowed everything that I had read in psychoanalysis or experienced, and I decided this was it. This was by far the most interesting thing you can do if you're a psychiatrist.
Yes, indeed. From your first session.
So, yeah.
Yeah.
So in the last over 40 years, I have done really very little else professionally than something that one way or another was related to non-ordinary states.
Indeed. Now, did you by any chance contact Jung about your experience or any of the other leaders of the
No, I mean,
movement?
you know, Jung was in a world that was not accessible to us. I mean, this was the Iron Curtain.
Oh, yes, 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 yes.
And,
of course.
And
of
was
course.
also very late, you know.
Yeah, sure.
So
I feel that, I'd like to hear what you have to say about it, but if he had lived longer and had some larger exposure as he was beginning to get to the Eastern teachings of Buddhism, Secret of the Golden Flower, that one of the other avenues that would have opened up to him is shamanism and the use of shamanically sanctioned plants. Do you think that?
Well, you see, Jung had
He's heading in that direction generally.
where he had very powerful spontaneous experiences, to the point that, you know, many times, is it psychosis, is there something else?
Yes.
And so I don't think he would have been very excited about something like psychedelics. I mean, he was, you know, he was very cautious and careful because of his personal.
Because he was
personal
relatively
experience.
fragile himself.
I think it was more important for
Psychologically.
him to stay grounded,
Yeah.
because he had too easy an access to the unconscious, you know, personal and collective.
Yes. It's, you know, but there are distinctions, and I'd like to hear what you have to say about the distinctions between the psychedelic realm, so to speak, and the dream world. What do you see and characterize as the differences between them?
Well, I actually see that there is a continuity. We see frequently that when people have a psychedelic session or a holotropic session, the dream of the previous night would anticipate it, or if something remains unresolved, the dreams kind of continue. But, you know, there are different kinds of dreams. There are dreams that don't meet the Freudian criteria. Jung talked about, you know, big dreams and so on.
Small dreams, sure.
So sometimes there could be really an archetypal being appearing in dreams, or I have seen and experienced dreams which were like episodes from another culture, from another century, that the quality of a kind of past life experience, rather than the kind of a confused quality of a dream that has to be deciphered in some complicated way. So.
Right, exactly. Just to go back a little bit, Stan, with the history of your meeting with psychedelics through LSD and then yourself, what was the way that you then integrated this into your psychiatric practice? This was at a time when this was still very unpopular. How was that greeted by the community at the time?
Well, actually, the professional community welcomed this. You know, it was a sort of fantastic discovery, because there was a substance that in absolutely minuscule dosages could change the psychological functioning for hours. And so the initial excitement was very scientific, was that, you know, maybe what is happening in naturally occurring psychosis is that the body chemistry produces some anomaly, some unusual substance through the metabolic processes, and then something like schizophrenia will not be actually a psychiatric disease, but will be a problem of chemistry. And then if we can identify the mechanisms, we can also bring in some other substances that would neutralize it or stop those reactions. So the initial excitement, was about these biochemical interactions, and we called it experimental psychosis. And so I was involved for a couple of years in this kind of research, looking at this as a clue to the understanding of natural psychosis.
Do you feel that that's what it is? I mean, do you feel that the psychedelic experience that you had with your experience of LSD was an experimental psychosis? Is that how you...
No, what I started seeing, that what we were dealing with was a catalyst, was a powerful catalyst, a substance that kind of increases the energetic niveau in the psyche, so that a certain dynamics that is there anyway, but it's not normally available, starts becoming conscious. But then I started seeing much in naturally occurring psychosis to be in the same category. And the reason why we don't have this understanding is because the map or the model is very narrow. We have a model in psychiatry that is limited to postnatal psychology or biography, what happened to us in infancy, in childhood, and later. And the individual unconscious, in the Freudian terms, which also is a kind of a derivative of the postnatal biographical dimension. Whereas what became obvious with LSD is that the psyche is much, much larger. So when I try to map the experiences that we were having, I had to add two additional domains to the biographical domain. One that I call perinatal, related to the trauma of birth, and then a vast domain which we now call transpersonal. So many of the experiences in psychotic patients which are considered to be products of pathology, products of some process that afflicts the brain, actually can be seen as normal contents of the deeper levels of the psyche. For example, a lot of people get a diagnosis of psychosis because they have death rebirths, or because they have experience of oneness with the universe, or because they have past life experiences. So for me these days those are experiences which are, legitimate. They belong to the psyche per se. You don't have to explain somehow how the content comes out of the brain and the kind of pathological processes that lead to it. So the problem is why certain processes which in these episodes become available in everyday life, why they are not available to everybody, why other people have to do half an hour of intense breathing before they get there, or why do they have to take LSD, or why do they have to meditate, whereas other people are flooded by those kinds of experiences in everyday life.
So is your conclusion about that difference in constitutional brain chemistry? Is your conclusion then that the difference of why some people will need breath work or hallucinogens,
yeah, I mean, there are biochemical processes,
is because of the difference in personal biochemistry?
Yeah, there certainly is part of the story that there are, chemical processes which can weaken the mechanisms that normally hold that kind of dynamics down. But the problem is not how these strange contents originate. Those are part of the psyche in the larger sense.
It's a question of access to them.
Yeah, but the difference is the trigger that in some people this deep dynamics is manifests, sort of comes into consciousness.
Sure, but do you think that the chemistry that a person comes into life with will determine their ease of access to the depths of the unconscious, or it's due to something other consideration?
Well, I'm sure biochemistry is part of it, but also the psychological history. There are people
So there are environmental
experience,
triggers.
Let's say difficult births, difficult prenatal history, the usual traumas in infancy, in childhood. All those can somehow keep the unconscious content closer to consciousness, more available, so that it can sort of erupt in certain stressful situations. But I think the primary problem is that we have just simply very map of the psyche. And so that, and what doesn't seem to be explainable in terms of that very limited map is attributed to some pathology of unknown origin, that will later be identified.
Just like science does when they label things magical. They just can't explain it. It doesn't mean it's necessarily magical. Truly. I mean, the entire universe, including science, is magical, if you want to think about it.
Yes.
But, you just reminding me, Stan, that the word psychosis is, of course, from the ancient Greek, which means full of psyche. And psyche, or psyche, really means breath, spirit, soul.
Sure.
And if someone is psychotic, literally speaking, what it really means is that they're full of life. There's nothing pathological about it at all. But, as you said, the psychiatric community and the psychological community, which was really the philosophical community not that long ago, closed down their awareness of the breadth of life, if you will. And I feel that poets and artists and other people who are just more in touch with themselves are aware of the larger breadth all along. And it's really the professionals, the experts, who have completely packaged this. And I think that there are actually political and economic reasons behind a lot of that, and fear behind some of that packaging. Do you think?
Yes. My concept of the psyche today, after 40 years of studying these states, is really very close to what you find in the Eastern spiritual philosophies, in some native cultures.
Yes. Some of what Stan is referring to is found in the cosmic game, which I guess we're all playing on one level or another. Yeah.
So in our Western psychology, Jung has the closest image of the psyche. We call it the psyche anima mundi. So our individual psyche is kind of teased out of this large cosmic matrix. It's not something that's happening inside of our skull.
Soul. Yeah.
And then, the closest thing in the Eastern philosophies would be the concept of Atman Brahman. We are not what they call nama rupa, name and shape. Or we would say body, body ego.
Yes.
We are much larger, and there are techniques through which we can somehow expand our consciousness and to reach the sort of the full dimensions of the psyche. So, ultimately, in the Hindu concept, we can realize that we are Atman, we are sort of a divine principle. And when we experience it, we realize that it's identical with the cosmic creative principle.
When you had your first experience with LSD, because you went from being, a normal medical student going towards psychiatry to having this experience of this incredible expanded state, which is not just visual, of course, it's very tactile, very kinesthetic. What did you think was going on? What did you sense? Not in psychiatric language, but just personally. Did you feel that you were meeting God? I mean, what was it that you were...
Yeah, you see, my first experience actually was one of my most powerful experiences.
Yes.
And what happened is that my preceptor was very interested in electroencephalography. And so I had to agree to have my EEG taken before, during, and after.
Oh, I see.
And at that time he was interested in something that's called driving the brain waves. He was exposing people to either acoustic frequencies or stroboscopic light, sort of optical frequencies.
What we have today is light and sound interface.
And he was trying to find out if the brain waves in the corresponding areas of the brain, which means suboccipital for the optical and the temporal for the acoustic, if the brain waves will pick up the frequency that you're feeding in, if you can entrain them, if you can drive them, towards certain frequencies. And so I have to also agree to have my brain waves driven. So when this experience was peaking,
a true guinea pig.
Yeah,
It's good.
this research assistant came and said it was time to drive the brain waves. So she took me to the small cabin, and I lay down. She pasted the electrodes on my head, and then brought this giant strobe and sort of placed it above my head. I closed my eyes, and she turned it on. And then in the next moment, there was this incredible light. I mean, beyond anything that I could have imagined. At that time, the only comparison I had, I said, this is what it must have been like in here. somewhere near the epicenter.
Yes.
Today I think it was more like the primary clear light of the Tibetan Book of the Dead. But what happened as a result of it, my consciousness left my body. I was catapulted out of my body. I left lost the research assistant and the clinic and then Prague and then the planet. And then the sense was that my consciousness had absolutely no boundaries. And so it became a very cosmic kind of an experience where I was the universe for all practical purposes. And there were processes, that later I thought might have been black holes and white holes and, supernovas. And she was very carefully following the protocol. She started with 2 frequencies and take it slowly to 60 and then back and then put it in the middle of the alpha band and then the theta band and the delta band, left it there for a while and then turn it off. And then, my universe started shrinking and I really very, very, with great difficulties found Prague and the body and then managed to align myself.
Identity.
And so that was a pretty, impressive experience for somebody who had never had any non-ordinary state except dreams.
Yes.
So that was very, very impressive. Of course, I was still very much under the influence of my medical training. So I thought, this was the key to understanding of mysticism, but understanding it scientifically as changes in brain biochemistry.
I like the way you put that, under the influence of my medical training.
Yeah.
It sounds like mass hypnosis, actually,
Yeah.
which it is, but some of it is good, of course.
I didn't realize at that point that it's like our birthright to have those experiences. And this was just one of the ways you can induce that.
Indeed.
But it was powerful enough to create this motivation. I mean, this is what I want to study, this is what I want to do. So I got hold of all the papers and everything that was written.
To date.
To date.
Yeah.
And
now, was that the real commencement of a professional and academic acceptance of the use of LSD at that time for therapeutic and psychiatric application, or at least experimentation?
Well, you see, LSD was actually accepted and was respectable in Czechoslovakia until the time that I left for my scholarship in the United States, which was 67. When I was leaving, LSD was listed in the Czechoslovakian pharmacopoeia, together with insulin, with tetracycline, antibiotics, with indications, contraindications. We had a system going where if you wanted to, you had to have a professional background. You had to be a psychologist or psychiatrist.
Yes.
You had to have 5 sessions under guidance, and then you had to do 30 sessions under supervision. And then it was decided whether or not you can work with it. And we had no problems, with LSD per se. Where the problem was, we couldn't talk about the fact that people had mystical experiences, and we couldn't talk about the fact that some of the stuff that was coming was very Freudian, because those were very delicate territories in a Marxist country.
Yes.
So when we talked about our research, we said these were the diagnoses of the patients, these were the dosages we gave, these were the numbers of the sessions, and these are the results. But we never talked about, if you live in that country, you know what you don't talk about.
That's right. Sure.
Now, when I came to the United States, it was interesting because it was exactly the opposite. There was nothing wrong with Freud, spirituality, religion was okay, but it was the drug.
In the late 60s, you're right. Yeah.
But it was the drug that was a problem.
Yes. Sure. But even within, so in other words, the use of LSD in Czechoslovakia wouldn't, even though it was in the pharmacopoeia, it wasn't enough to alter the paradigm of pathology so that it would be redefined to be broader than the rest of Western psychiatry, huh?
No, this was very widespread. We were one of the 2 countries actually producing LSD pharmaceutically. One was Switzerland, one was... There were only 2 official sources.
Oh.
So there were about 40 places when I was leaving. But, not everybody really took it in the direction I did. There were people who were using lower dosages, kept it more as kind of drug-assisted psychoanalysis. There were others who were more studying the phenomenology, how many people saw abstract images, how many people saw animals, how many people saw landscapes, were people sweating, did they have headache? This kind of just a phenomenological description without looking sort of deeper into it.
Yeah. Now, just accepting the standard paradigm for a moment, how would you describe the value of the therapeutic results from people that were given LSD back in those times, in the late?
Well, it's just a powerful catalyst. I mean, you can accelerate, intensify the psychedelic, the psychotherapeutic process enormously.
Sure.
You can reach categories of patients that you couldn't possibly reach by talking. Like there were tremendous results, with alcoholics, with heroin addicts.
Oh, there were, huh? Very documented results.
Yeah, criminal recidivists and so on.
Right, exactly. That was about what I was about to mention with Timothy Leary, who had really quite significant results with the treatment of criminals and the reduction of recidivism. And I was wondering if there was a parallel.
This was psilocybin. Yeah.
Mm-hmm.
So those were these results. That you cannot really achieve by talking at all. And probably our most moving study was with cancer patients.
Really?
Where if dying cancer patients, terminal cancer patients, have powerful mystical experiences through psychedelics, they lose fear of death, and the dying process is transformed. So that's not what you can easily do by talking.
That's right. Well, Stan, this has been just a pleasure. We'll pick up now that we've laid the groundwork of history, in a sense, with some of your more modern work and with the breath work and on your book, The Cosmic Game. We've been speaking with Dr. Stanislav Grof, the author of this book, psychiatrist, transpersonal psychologist, man of great world renown for his breakthrough work in expanding the paradigms of psychotherapy, psychology, psychiatry, far beyond. And so we're very glad to have him. Please stay tuned. The next show will also be following up with Stan and going into greater depth about his work currently. Thanks so much for joining us. This is Mitchell J. Rabin for A Better World. Please feel free to give a call at 212-420-0800, and I look forward to seeing you all next week.